It's an absolute delight to be here and to have had the pleasure of hearing from three very different speakers today. And I want to start in reverse order. And Julie, to thank you so much for bringing to our attention the work that's being done so close to us. We are such a wealthy, lucky country. I'm a nurse and a midwife. I've got two children. One of them would have died if I'd had them in another country, in many other countries. But I had the best of what's possible in relation to birth, and it seems such a shame and such an embarrassment that we live so close to so many countries that are so less well off than we are. So, Julia, I want to actually thank you not only for what you were saying, but for bringing courageously to our attention the fact that the government really is dropping the ball, and that we collectively have a responsibility to put some pressure back on whoever is in government, because it's not a partisan political issue. This is a national responsibility, I think. So thank you very much for your really informative talk. It took me absolutely back to seeing some babies born in Timor-Leste just a couple of years ago, so thank you very much. Kirsten, thank you for your conversation about the importance of research and research into contraception. Without the research, we don't actually know where to put the emphasis and where to put the funding and the support. And last but by no means least, I want to thank and acknowledge Sandra. As someone who works at the University of Sydney and in the Faculty of Nursing and Midwifery, I can't tell you how proud I was to see you up here and to hear your command of the issues at stake, and the issues that are so important to, I was going to say the women of your country, but it's not. It's actually to the whole of the country of Kenya. But this issue is so complex. This issue is such a socio-culturally deep issue, and an issue that involves, traditional socio-cultural relationships between men and women. It's by no means easy. The Millennium Development Goals back to 2015 tried to do something focused on gender equality and on women and children, and the Sustainable Development Goals, which are the new UN goals that will take us from 2015 to 2030, have an even greater emphasis in this area. As Kirsten told us, the World Health Organisation's woken up to the fact that research is showing that you can do some contraception earlier than had been thought. And I think one of the, interesting but very potent changes was actually a change in one woman, Melinda Gates. Melinda Gates, deeply Catholic woman, so had been shying away from the issue of contraception until about 2 years ago, where she finally was convinced that despite her deeply religiously held beliefs, that she knew that the social and economic development of women around the world, and therefore countries around the world, was completely associated with women's contraception. And so the Gates Foundation now have got a commitment to 120 million extra women receiving high quality contraception by 2020. Does that let us off the hook? Absolutely not. That's focused in the poorest countries. It does not let Australia off the hook. And particularly groups like Women's Plan Foundation, where the focus is on our local areas, Asia Pacific areas. I mean, quicker to get to Papua New Guinea, quicker to get to the Solomons, quicker to get to Timor-Leste than it is to get to Perth. And yet we have these anomalies. So thank you very much to our three speakers. And before I finish, I know you would want me also to thank Alice for her passion, for her tireless, courageous efforts in the Women's Plan Foundation. And Alice, I think today, absolutely epitomised what it is that Women's Plan Foundation, through you, tries to do, where there's help for the skilling of skilled health professionals. There's help for research into this area. And there's absolutely commitment to partnerships with particularly the NGOs who are doing the things that government should be doing more of, but NGOs have a commitment to. So thank you, Alice. Thank you, Sandra. Thank you, Kirsten. And thank you, Julia.